Obsessive-Compulsive Disorder (OCD) is a mental health condition that causes individuals to have unwanted, intrusive thoughts, images, or impulses, obsessions, that are often accompanied by repetitive behaviors or mental acts, compulsions, intended to neutralize or alleviate the anxiety or distress caused by the obsessions. Some common obsessions include fears of contamination, harm to oneself or others, and doubts about whether one has completed a task properly. Compulsions may involve behaviors such as excessive washing, checking, or counting, or mental acts such as repeating certain phrases or prayers. OCD can significantly interfere with daily life, causing distress and impairment in social, occupational, or academic functioning. Treatment options include cognitive behavioral therapy, CBT, medication, or a combination of both. With appropriate treatment, many people with OCD can learn to manage their symptoms and improve their quality of life. In addition to CBT and medication, other forms of therapy may also be helpful in treating OCD. These include exposure and response prevention, ERP, which involves gradually exposing individuals to situations that trigger their obsessions while preventing them from engaging in compulsive behaviors. This can help individuals learn to tolerate the anxiety caused by their obsessions without relying on compulsions to alleviate it. Mindfulness-based therapies, such as mindfulness-based cognitive therapy, MBCT, and acceptance and commitment therapy, ACT, may also be beneficial in reducing OCD symptoms by helping individuals learn to accept and tolerate their thoughts and feelings without judgment. It's important to note that OCD is a treatable condition, and seeking help from a mental health professional can be a critical first step in managing symptoms. Additionally, practicing self-care techniques such as regular exercise, getting enough sleep, and eating a balanced diet can help improve overall mental health and reduce anxiety and stress. Obsessive-Compulsive Disorder (OCD) is a mental health condition characterized by unwanted and intrusive thoughts, images, or urges, obsessions, that lead to repetitive behaviors or mental acts, compulsions. These obsessions and compulsions can significantly interfere with a person's daily life, causing distress and impairing their ability to function. Fortunately, OCD can be effectively treated with a combination of therapy and medication. Here are some commonly used treatments for OCD. Cognitive behavioral therapy, CBT. CBT is a type of therapy that helps individuals learn to identify and challenge their negative thoughts and beliefs. In the case of OCD, CBT focuses on helping individuals recognize the irrationality of their obsessions and teaching them how to resist the urge to engage in compulsive behaviors. Exposure and response prevention, ERP. ERP is a specific type of CBT that involves gradually exposing individuals to the situations or triggers that typically trigger their obsessive thoughts. Through this exposure, individuals learn to tolerate their anxiety without resorting to compulsive behaviors. Medications, antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, are often used to treat OCD. These medications can help reduce the severity of obsessions and compulsions by altering brain chemistry. It's important to note that OCD is a chronic condition, and treatment may need to be ongoing to manage symptoms effectively. Additionally, finding the right treatment approach may take some trial and error, as different treatments may work better for different individuals. If you or someone you know is struggling with OCD, it's important to seek professional help from a mental health provider. Mindfulness-based interventions. Mindfulness-based interventions can help individuals with OCD learn to accept their obsessions and resist engaging in compulsions. Mindfulness-based interventions can be offered as part of CBT or as a standalone treatment. Acceptance and commitment therapy, ACT, ACT is another type of therapy that can be effective for treating OCD. ACT helps individuals learn to accept their obsessions without judgment and to focus on living a meaningful life despite their symptoms. Deep brain stimulation, DBS, for individuals with severe OCD who have not responded to other treatments. DBS may be an option. DBS involves surgically implanting electrodes in the brain and delivering electrical impulses to targeted areas of the brain. While DBS is not a cure for OCD, it can help alleviate symptoms for some individuals. In addition to these treatments, self-help strategies such as exercise, stress reduction, and maintaining a healthy lifestyle can also be beneficial for managing OCD symptoms. It's important to remember that everyone's experience with OCD is different, and what works for one person may not work for another. With the right treatment and support, however, individuals with OCD can learn to manage their symptoms and lead fulfilling lives.